I'm going to share my screen really quickly. Here we go. Perfect. And again, if anybody has any questions throughout, please don't hesitate to drop it in the chat and we'll make sure to answer those. So very quickly, what we're hoping, like we said, that you get out of today is, and I'm so happy so many of you mentioned this, of already starting to have those conversations, and the places that you're already having with conversations in terms of, yes, family and friends tend to be some of the most fruitful conversations you can have because you always have access to those people and they have access to you. So it's a really good foundational kind of building block, and we're going to give you more of those ideas of where to have those. And also, we really hope that you leave feeling empowered to develop a plan of whether you want to start these conversations on a grassroots level in your community or on a digital level. We are really here to help facilitate any of those endeavors that you'd like to go through. So This Is Our Shot was founded out of a desire to remove obstacles from health professionals' ability to, again, use the megaphone they have inherently as trusted messengers. We aim to give you the tools to do so, and so far we have earned over 500 million total impressions. Now, this is the footnote that I always give with this. 500 million impressions is a beautiful big number and we love it. That is significantly less important to me. I care not at all if your content if it gets 12 impressions. I don't really care. I care significantly more about you having conversations and actually planting seeds with people and changing 3 people's mind. Like that's what we're actually measuring here, far more than digital impressions. So what is success is really about that personal connection. We know that you are uniquely positioned to do this as health professionals. 8 in 10 people say that they will turn to doctors, nurses, and other health providers when deciding whether to get vaccinated. Really important here, this is not their doctors or nurses. It is doctors, nurses, or health providers in general, because we know that a lot of people don't have a regular doctor. Insurance changes make it particularly difficult for people to stay with one doctor. So this is really about your credibility as a health professional, period, not necessarily just your patients. So again, this is about your friends and your family and the people you work out with and the people that you go to church with and the people that you share recipes online with. Those are the people that you still have significantly more credibility and are a more trusted messenger solely off of the fact that you have all of this experience and knowledge as a medical health professional. So with that being said, I'm going to hand it over to the wonderful Dr. LaTanya Hines, who has agreed to give this portion of the presentation for us. Like I said, star power. We know what we're doing over here.
All righty. Can everyone hear me? So what I'd like to do is to create a conversation that really talks about who we are, the importance of who we are in the community, and how we can have an impact. Next slide. So main thing, what are your feelings towards the vaccination? Why do you feel that way? What concerns do you have about the vaccine? What reasons would motivate you to get vaccinated? Let's be clear. Ready? I'm going to talk as if I'm talking personally to all of you because I love you all. You're all my family. When someone says, and you bring up the idea, what about the COVID vaccine? It's important. It's still going to be with us. They say to you, I would be scared. I don't know what to make of it. I've been on the internet. I don't understand. What does all that mean? One of the things is if you can make a connection. Well, first of all, if you're talking to an African-American patient, you've already got a connection. You guys probably share the same culture in the sense of, same foods, mom and them, family. Y'all know what I'm talking about. But when they say, well, I'm scared, I don't believe in all that. First question, why? Why don't you? And for a little moment there, make sure that you put a little piece of you in there and say, you know what, when I first thought about it, I had some questions as well. What are your questions? Okay. Once you say, what are your questions? You hope that they're open enough to talk to you. Now, some people will just say to you, I ain't trying to talk to you right now. I got things to do. I ain't got time to talk. Drop a seed. say, well, if you would like to talk about it, I really am interested in making sure that you are protected, that your family's protected, and please use the word trust, Trust. I want you to know that you can trust me. I am interested in your welfare. I am interested in your well-being. If nobody else you think cares about you, I do. Make it personal. Find common goals. As we said, we all go to the same school. I see some of the slides here talking about we all want to reopen. I'm going to be clear with you. I have not gotten that as an interest per se with my Black patients. They don't care whether or not we open schools. They care whether or not they can go to work. They care whether or not it's safe to do so. So the question is, when you talk with them, where is it? And when I say make it personal, you can hear what it is that's important to them. It might be why they showed up at that visit. Next slide. So my colleague, our colleague said this so well yesterday, it bears without repeating, but I'm gonna say it because she was so good. Black folks got a real reason not to trust the healthcare industry. This is a system in which it was designed not for us. There are levels of systemic bias that we all understand. We only represent 2.5% of the American physician population for Black women, and total 5% if you count all the Black folks who claim to be Black. So when you look at that number, 95% of us don't look like the physicians that our patients see. Therefore, how do I know that you don't represent all the rest of what those other physicians say to me? And this is important because this is the way they were treated last week. This is the way that they were treated when they called for an appointment. This is the way that when they brought their family member in for the ER. So now you telling me you want to give me a vaccine? You know what I'm talking about. So history is real, science is real, and yes, they can coexist. So now you have to be the messenger to represent what's important about science. Science is real, and I say that up front. This is the same science that treats you for your blood pressure, treats you for your headaches, your colds, treats you when you're bleeding abnormally, treats you for your pregnancy. Same science. So if you believe in that, tell me, what is the question about vaccinations? Because vaccinations, to some extent, as you guys know on this call, are what make this a first world nation. Vaccines and the ability to reduce illness and virus in the population tells us that we are a first world nation. So Black physicians and scientists were involved in every step of the vaccine research and development. Remember this name, Kizimia, I forget her last name right now, Kizimia Corbett, a Black, although African, y'all know how that is, but let's be clear, Black woman helping with the virology and the design of the vaccine and the spike protein. Sometimes just knowing that one of us was involved is important. Black physicians are working as trusted messengers to ensure the science community knows that Black lives do matter. I bring up right here for many people that remember when the vaccine first came out and all of the less than ethnic people were going to King Drew and many of the ethnic centers to get vaccines, and we were not in line. You wonder why? And I think that's important. Let that sit when you're talking to somebody. Why do you think that non-Black folk, let's be clear, white folk, would come down to Wilmington Boulevard to get a vaccine? You think it's poison? So there was an appropriate representation of Black people in the research studies. When we think about Pfizer, we think about Moderna, there were at least approximately about 30,000, a little bit less in one study versus the other, but approximately 30,000, maybe 27,000 in the other, that one study could not go forward until there was enough representation. That was Moderna. So they did everything that they could to do the best they could to make sure that there were enough people of color, Black folk, brown folk, Asian folk, women. We on this call know what phase 1, 2, and 3 trials were. Phase 1 trials, to some extent, are the true pioneers, the people who are willing, unfortunately, to have quite severe side effects and possibly die in order to go forward and see if the science is real. By the time we got to phase 2 and realized that this was real and we expanded it, that's when, of course, we had way more folks in there who became pregnant during the study. And that's important because we found, although there were few pregnant people in the studies, none of them, it appears, had any negative outcomes. Some of them are still pregnant. So it's important to know that we basically got everybody in those studies. Let me remind you that phase 1 studies do not or should not have people less than age 18, people over the age of 75, and pregnant people that you know. Why? Because that's the vulnerable part of the population. So when people talk about, well, those people weren't in the study, they were designed not to be in the study in the beginning, because we needed to know whether or not we had enough healthy people who could get the vaccine and perhaps have a good outcome. Informed consent and new regulations have been put in place to ensure safety is adhered to, and atrocities like the Tuskegee experiment will never happen again. Let's be clear. The Tuskegee experiment happened in my lifetime. And yes, it is sickening. I have said this on more than one occasion, but this is the withholding of care, not the application of care. These people didn't get penicillin knowing that they had syphilis, and we were watching them through stage 1, 2, and 3 tertiary care syphilis. This is people who we are trying to prevent illness. So sometimes you have to actually break down the difference between lack of treatment, absence, withholding of treatment, and saying, I want to offer you a treatment to reduce the potential for illness. There is a very real difference there on this call for physicians. But when you're talking to patients, they need to understand that, because most of them don't even understand what Tuskegee is, except it's a buzzword to give you because they don't want the vaccine. Next slide. So the vaccine will keep you safe. I find that talking about the vaccine keeping you safe is not as powerful as linking their health to their family. They go to work. If you're talking to them, they're sitting in front of you because they either have insurance or some connection with insurance. So therefore, they've got at least some connection to the healthcare field. And the key that usually is that they have a job. So they're out in the world potentially being exposed. More than likely for African Americans is a higher percentage of essential workers. So they're living in an environment in which there are many people that think the way they do. So that means that not only are you talking to someone who is vaccine hesitant in front of you, but they represent several people in their family and in their community that think the same way. So by having an impact on that person, you are potentially having an influence on several. So what you say makes a huge difference. So when you talk about, are you aware that every time you go out, every time you go and do your job, and I know that's important to make sure that you're taking care of your family, that you potentially might be the source for the virus that you bring home. I find that that is powerful. Not that they might get sick, but that the people who they love, they could bring it to them. That's important. And if that doesn't seem to ring with them, just let them know that the people, the group in which they live, if you all think the same way and are not consistent with the use of the protective gear, which, as you know, as we have decreased masks, as we have gotten a little more willy-nilly, these are the groups where the virus will be more than happy to flourish, because there are no vaccinated or very few vaccinated people in those populations that can help to protect. That seems to ring for some people with a little bit more accuracy than others. So 180 million vaccines that have been given in this country. 60+%, I believe, have either one vaccine or at least two. But let me be clear, there are 300+ million people in this country, and we need upwards of at least 2/3 of that number to have what we call herd immunity. So let's once again, no, we don't have herd immunity. It does not appear that we will have it anytime soon. We have made a substantial impact on the numbers of people who are getting the infection, and that's important. Next slide. Oh, Dr. Goffney, I'll see you. So side effects. People are afraid of having side effects. It's interesting that people are more afraid of having side effects than having the virus. I know y'all know what I'm talking about. So ultimately, what are we trying to say? Frame this when you talk about side effects as this is the body's normal and positive response to an important immune response and protection for you. So when you have a sore arm, you take your Motrin or Tylenol. When you're feeling tired and fatigued, it's the body's way of using that energy to make the antibodies that will protect you in the future. Every time they say, well, I didn't like this, I didn't like that, that's what my friend said. Don't tell them about how bad the actual infection is. That don't work. Because remember, we're talking about people that many times feel that they're covered in the blood of Jesus. They don't think they're going to get it anyway. So what you got to do is make the connection that on a personal level, these are transient symptoms. They're less than 12 to 24 hours. More than likely, you should do quite well. Versus taking the risk each and every day of getting this infection because you're unvaccinated. Next slide. So the best vaccine, they'll say, well, which one should you get? Girl, I heard about the Johnson & Johnson. I don't know about that. Hold up. Moderna, Pfizer, ones get the vaccine, 3 weeks later, get the second vaccine. One Moderna, get the vaccine, 4 weeks later, get the second vaccine. Girl, I don't want none of that. But I know you don't want to get infected. But I know you still got to go to work and take care of your family. What I'm saying is get the one vaccine and let's get going here. They'll say, but I heard about the clots. If you think about the increased risk of clot formation from the actual infection in comparison to the minuscule percentage of those patients who had clots, and don't get me wrong, we could talk about that, but ultimately, what does that mean? They were women. And for those who deal with women and take care of women, women are at increased risk because of estrogen. And I believe that some of those women, although I think it's 4 or 6 of them, they were taking estrogen-containing compounds. And we know that that's an increased coagulability effect. Don't go into that kind of detail. Patients don't know what you're talking about. But say to them that the risk of clot formation for the vaccine is exponentially lower than what happens when they actually get the virus. Remember, you want to hit hard that they're likely in a community in which lots of people think the same way they do. So we're having this conversation amongst lots of people who probably not wearing their masks, who don't think it's going to happen to them, but they understand that they're an increased risk. That's why they're talking to you. So what's the thing? Get the vaccine. And then you can at least reduce your own personal anxiety about the likelihood of acquiring the virus. And oh, by the way, nothing's perfect. You might need to say that often. Nothing is perfect. I give this example when we talk about the rain. Y'all probably heard me because I've been on all these shows. COVID is like rain and it's still raining. Your mask, your shield is like an umbrella. When you go outside with your umbrella, you feel some modicum of protection from the water. Do you still get wet? Yes. But if you get the vaccine, it's like having a raincoat. Do you feel better out in the rain with your raincoat and your umbrella? Yes. Is that the same as just not going outside? No. On the same hand, do you have that option to live the rest of your life inside your house? Most people, no. So I find the rain analogy seems to help people because then they're like, well, I've been wearing my umbrella, but now with all these people outside, it's raining hard. I might want to get me a raincoat. That's the vaccine. Next slide. So inspire questions. That's why I'm here. I think what's helpful, because I like to talk, y'all know that, is just to step back for a moment and say, do you have questions for me? Most of the time they say, did you get the vaccine? With all this talk, I say, yes, I did. And I also say, I was concerned. I was a little bit scared because I didn't know what was happening. They go, what? I say, yeah, I'm human. And although I believe in science, I don't know. But here's what I do know. I watched 3 of my patients die in the ICU, pregnant patients. I watched countless numbers of people being admitted to the hospital to the point where we couldn't figure out where we gonna put them. Pregnant patients. That's 2 people, not 1. I ain't trying to be part of a situation in which I'm complicit. I'm saying I really don't believe in I said, my name is LaTanya Hines, OBGYN, board certified. I believe in science. Here's my left arm. I'll stand up for you. I'll stand in the gap. I'll be the first one. Come on with it. And once I got the vaccine, had the experience that I had, not too bad. I took my motion round the clock because I'm a doctor. I told my husband, I said, go on up there and get your vaccine. He came back, got his second vaccine, doing fine. When they said they had some extras, I said, my kids. I always tell my patients, I wouldn't say or do anything to you for you that I have not or would not do for myself or my family. I believe it. And that level of integrity and belief is what I bring to work every day. And I know that everyone on this call feels the same way. So with that kind of connection, that is how we make the connection to help folks. And remember, there are those who will not be able to convince. Please stop wasting your time. You know exactly when they look you in the face and say, go away with me with this. I ain't got time for that. You decide whether or not you want to invest. I would suggest to you, if you're very clear that this ain't working, stop wasting your time. Drop a note. I'm here if you need to talk to me about it. Please wear your mask. I want you to be safe. Because when you say, I want you to be safe, and you mean it, they understand that you know that they're having difficulty. They may come back and talk to you. Next slide. I think I'm done, right? Or no? Okay. The vaccine is built on 20
one
years.
more. I accidentally skipped it, and I noticed that.
I thought I was done.
I had to go back. That's my bad. Sorry.
No problem. So one of the things that I found, please don't talk about messenger RNA and talk about the spike protein and the ability of the virus and how it binds. Don't nobody care. They don't understand what you talk about anyway. And if they do understand it, who cares? What they care about is, I thought that they built this thing too fast. That's where when you talk about phase 1, 2, and 3 trials, I think that helps. Because we used to do phase 1 trial over a certain period of time, and then we go to phase 2, and then we go to phase 3. What we did was we got enough volunteers to run phase 1, 2, and 3 at one time. And given the information by a Black woman and a German and French woman 10 years ago who were talking about messenger RNA as a vehicle to get the virus into, should say the antibody vaccine into cells, you could touch a little bit, if you want, on the science of vectors and how you could get a vaccine into the cell. I think that might be helpful for some people. But ultimately, here's what I found is interesting when we talk to Black folks. I don't know all Black people. I'm just saying this is what I found. When you say that the United States was not interested in the science behind COVID because it was in somebody else's country, that it had not come to this country and had affected enough people to be important, you get people's attention. Because Black folks understand that in this system in which we live, the government ain't never been interested in us anyway. So now they get the connection between the United States wasn't interested in China until it got to our shore. And so now they understand that when it got to our shore, unfortunately, the science and the people behind normally the mobilization of didn't work. Bring up President Trump for a second and just say, President Trump did not think it was important, but President Obama did, in the sense of the importance of vaccines and the preparation for a pandemic. Connection. And then bring up the fact that President Obama did the best he could, but he's not in office. There's a new president, and as far as he was concerned, it wasn't that important until 600,000 people died. When you talk about the percentage of that 600,000 plus people that died, all the Black folks know somebody personally that has died. But once again, they don't think it's going to happen to them, except they don't want it to happen to them. So it's important for them to go, okay, I get it now. So if you don't want to be part of that number and you want to do what you can in order to reduce your risk, then the vaccine is an excellent option. I'm not telling you what to do. I'm putting it out there for you to make the decision. I think that helps a lot of people. And then every now and then lately, I've told my cousin, it's actually my first cousin, whose first cousin works for Inglewood Mortuary. He just bought his second Mercedes 500 SEL. Can I be clear that business is booming in the funeral business? And the cause of death as COVID for Black folk. Now, Black folk, I mean, that's kind of morbid, but they know. So let us be clear that there are people out there exploiting this and making money off of it because there's money to be made. So when they want to talk about the money that's being made off of the vaccine and the pharmaceutical companies, come on now. What about the money being made off of the dead folks? you ain't trying to be one of them. So the key is you can hit it with the science, but I think some of those things that we know in our own community and how we talk to our family members, I think really makes a difference. And I think now this is the last slide. Next.
Yes, we have
Okay.
2 questions that I'd love
Sure.
to get to before we get. The first one is from Kelly, and I believe actually the second one is from Kelly Butler as well.
Hey, Kelly. That's my student.
Oh, yes. Kelly, if you want to ask your questions, by all means, otherwise I'm happy to read them.
Yeah. So you started to touch on it, Dr. Hines, but it was in the context of like science is real, history is real, and the two people exist. I've heard a lot from the but it was produced too fast crowd. I'm just going to let a couple people get it first and then I'll get it because they just don't trust the science, nor do they have the capacity to understand it. So I wonder how you interact with those folks when the science, you can't present any paper, article, you can't present any of that objective evidence to convince this person because they're just inherently not going to hear the scientific part of the argument.
Black folks understand money, Kelly. I think about 180 million vaccines that have been given in this country, 300 million people. I tell people, I want you to think about 180 million vaccine doses as money. In any language, $180 million is a lot of money. It's a lot of people that have been vaccinated. So when you tell me that it's 1 or 2 or 30,000 in this study, 60,000, 180 million, even if you divided that by 2, that's 90 million. It's a lot of people. Sometimes you have to throw the question back at the person and say, well, what number would make you feel better? Everybody in the world? That's 7 billion. How many does it take? 600,000 people died. Oh, we can throw numbers out. The question is, you have to ask them and they'll tell you what makes them uncomfortable. If they say, well, I think it's just been done too fast, you say, well, we didn't have a choice. We needed to run the studies differently, but we had the science to do so. We can even talk about that when we look at the genetics and how we did the genetic transcript on the virus, because we had already done the human genome during both President Obama and President Bush. So we had the ability within the first week of January from China to know what the genome was for the virus. Once you know the template, you can now start to work with it. You can find where it is weak and not. That's why all of the vaccines went after the spike protein. Why? Close the door. I give examples about that. What's the spike protein to some extent and say, if you can't get the virus into the system, then you can't get infected. So I said, how about this? I teach you how to barricade your door to such a point, every single door in your house, so that the person who's trying to get in, which we'll say is the virus, can't get in. That's it. Are you safe inside that house? As best you can be, keeping the virus out. I didn't change you in any way. So when they tell me about microwaves and whatever waves, I'm like, I didn't change nothing about you. I said, I'm blocking you from getting in. Does that make sense? And what the variants are people who have figured out how to get through your barriers. They inching away at. And so the goal is to get the vaccine in the first place so you have some protection. That's right. So analogy, I think, works really well for our population. I think depending upon the level of scientific knowledge, you can get into a lot more detail, but I find that people's eyes glaze over when you start to talk about messenger RNA and how there are receptors on cells and the ACE, it's not ACE inhibitor, but I believe it's an ACE something where it binds. I'm like, no, they don't want to talk about that. Yeah. What they want to hear about is, does it work? And the question is, look around you. So now that everybody is going to take off their mask, I want you to notice that if we could, kind of measure the levels of cortisol amongst the people who take their mask off that are unvaccinated. They know they unvaccinated. They know you don't know, but they know. And I think that this whole process, it's reversed, but I think we'll get a few more hesitant people to be vaccinated just because it's not group herd mentality. It's that, oh God, I was being protected by all the other people with the mask on. Now we take the mask off and I don't know who's who.
So that was actually my second question. It came around your rain analogy. It's about to rain really hard. On the 15th is when California has basically dropped all protections legally.
We're about to have a storm.
So
yes.
it inappropriately sends the message that everything's okay and it's not raining outside.
Oh, yeah.
So how to combat that disparity in messaging is my next question.
The question is, no longer will we be beating you over the head to get the vaccine. We're not going to make it as easy as possible to go to CVS, to go to Rite Aid, no appointments, get your vaccine. If you are waiting for someone to do something for you, I've said this on more than one occasion, you're waiting for somebody to help you with your health care to prevent you from getting an infection. Since when has this country ever been doing something for you? You know that as an African-American or a person of color, you're going to have to help yourself. So if you don't get your vaccine, then you do the best you can. And if you end up with the infection, hope and a prayer is not something that I believe in. But if that's what you believe in, go on with it. Sometimes you got to just let that go and just say, I'm doing the best I can. I want to give you as much knowledge as possible and make sure that you put it in their hands to make the decision. Maybe that's just my personality, but I don't want to waste my time with people that ain't listening or not even willing, to do so.
Well, what you just said was relating to what I was thinking, because a lot of the people that are not getting vaccinated are religious people.
Absolutely.
And it's very challenging for me to really make an impact there.
Absolutely.
So I was wondering if anybody has had much encounter in anything that's worked for them with those particular people.
I don't think that there is an argument against faith. There just isn't. There's no argument against that. What you have to do is to be accepting that there is, if you are a believer, that God is real and that in this world in which we live, we can't possibly know and understand everything. But I do believe that God has imparted the science and the wisdom in the scientists, in the physicians, and in those healers that they trust to do the best that they can in an environment in which there is a pandemic. If they choose to believe only in faith, that is their right. What they don't have is the right to infect others. They may not like you to say that, but that is true. I really, and they, folks don't like that. But here's the deal. The one thing about this virus is that if it was just you, if it was just perhaps the extreme right wing of the, conservative and Republican Party, or the very, very religious people or whatever, but they impact others. So making that connection that your decisions have an impact on other people that you love and care about is important. Sometimes it's as simple as, would you like to visit your grandmother or grandfather or other vulnerable people in your family and not increase the risk for them getting infected? Or do you not care about them? Speak on an empathetic level at which I know you understand me. And if you believe that God is going to protect you from bringing the virus to that person, yet what if they get sick? What could you do to protect them? They will at least wear a mask. That's the one thing. You could definitely push, you got to wear your protection. It's not an option. And most of them will say yes.
Yeah.
Okay. So meet them where they are. I think that's really important. That's the one thing. I'm sorry, Denise, I didn't say that. We say that in our own office. Meet them where they are. You ain't gonna convince everybody, but just say, I see where you are right now, and I just want you to be safe. Can you wear your mask? Can you do that for me?
Have you ever used the analogy of the polio vaccine and how effective that has been?
I have, in the sense that it is one of the vaccines. I got my whole T-shirt that talks about, all the various vaccines from diphtheria to whooping cough to measles, mumps, rubella, and at the top it says COVID on my T-shirt, because these are vaccines that have changed the way that we live here in this country as a first world nation. Once again, Black folks don't care about that, and many of them are not necessarily vaccinated or forgot that they were vaccinated. I even show them my smallpox vaccine. Y'all know what I'm talking about. I say, you remember this? Y'all didn't even know. Remember you was in school, you got a vaccine, right? We have eliminated to some extent smallpox, and yet they understand that measles breaks out amongst the colonies in Malibu, right? Because this is a group of people confined who don't believe in vaccinations. But let me be clear about people that don't believe in vaccinations. Usually the anti-vaxxers don't look like Black folk, not many. And they have the resources and the ability to isolate themselves in communities in which it is likely that they won't be exposed. Do Black folks have those opportunities and options? Less likely. Once again, a whole nother argument there. But I think that's important. You wake up every day, get in your car, and you drive down the street to go to work. You are not in Malibu. You on Crenshaw. So what are we going to do to reduce the risk that you being exposed? I think you have to make it just that plain. You get higher and really start to talk about the levels of academic knowledge that we have, and you lose people, and then they feel like you are different. But I hope that I'm making that difference with patients, because, you know, I'm just as Black as they are every day. Other questions?
I would really love to uplift Dr. Wilburn's questions around how you approach this conversation with either laboring patients, pregnant patients, or patients that wish to become pregnant.
Patients that wish to become pregnant, I actively talk about the importance of both maternal and fetal protection and when the baby is due. You know, I see patients every single day, and for this past few months, we've been talking about when the babies are due. Everybody who's pregnant now is due at the end of the year. And so they are due during flu and cold season. So flu season starts in September. So we start with flu vaccinations early, and then, you know, COVID is not gone. So I tell them that when we start with a change in weather, and it's not the weather as much as it is the aggregation of people in places that are indoors that increases the likelihood of exposure, you too will be in that arena 9 months pregnant. I know you don't want your baby to get this. And so what I give them is at least two options. One, get vaccinated during pregnancy, and there will be at least a few studies coming forward to talk about when is the best trimester to be vaccinated, the most effective. It appears all three will be good, but we'll see. But if they decide they don't want to be vaccinated in pregnancy because they believe somehow or another it may affect the baby, then your baby has an immature immune system. First 6 months of life, this baby only has what you gave it. So to some extent, and it's not mature. But if you didn't give the antibodies for COVID, the baby doesn't have it. Therefore, if you get vaccinated post-pregnancy in the postpartum period, you can at least, as the primary caregiver, reduce the risk of exposure. But one day you're going to take the baby outside. One day grandma and grandpa going to come over, Pookie and them and Ray, they coming. And they are not vaccinated. What you going to do for them? You going to make them all be vaccinated? What are you going to do? And that's when they start to go, oh, I hadn't thought that through. Exactly. And then if you start talking about the studies with regard to pediatric COVID and things like that, for most babies, because it appears this receptor is not as mature, they don't seem to get so ill, that's a good thing. However, who are the babies and you know, adolescents that have the worst outcomes? The ones that look like us. So for every study, everything we talk about, Black and brown people have a disproportionate increase in the severity of the illness. Black folk know that. They may not know how to say it like that, but they know it. So I think when you present it like that, they go, okay, maybe I'll think about it. That's all right. I got how many more weeks to keep hitting you on this vaccine? They take the whooping cough vaccine, which is 96% effective. You mean to tell me we can't talk about COVID? So I just keep wearing them down as best I can. And if you're, you know, postpartum, you just do that. Like I said, do the best you can. Yes, ma'am. And no, it does not affect fertility. Did I throw that in there? So they can stop with all that. No.
Can you can you make comment though for those women who are saying, but we don't know the long-term effects on my unborn child? I've had them, you know, approach me that way, and I'm trying to find a good way to answer them, you know, in terms of their—
we don't know.
Mm-hmm.
Well, you don't have to, you know, make that up. Just say we don't know. What we do know is that the long-term effects of long-haul COVID and scarring of the lungs is real. Mm-hmm. And that's a long-term effect that ain't going nowhere. What we do know is that there appears to be perhaps some triggering of autoimmune response, which is horrible with COVID. And that seems to be a long-term situation. Hypercoagulable state. I mean, it's all horrible. So yes, I don't know the long-term effects. And of course, those are for patients who have issues with autism and just the rampant information and misinformation on the internet about that. Mm. But one thing that if they really do their research, they'll recognize is that advanced maternal age and patients with hypertension, diabetes, and obesity those patients in that group are certainly at increased risk of those particular issues with autism. You can read it, but they don't read that. They read that, well, my baby's going to have so-and-so. And so you have to respect that. That's another thing too. I'm not that bad, y'all. I'm not that dogmatic. I say, I got you. I understand. And respect that. Back off and say, okay, I understand. Including those who get COVID in pregnancy. And I've got to admit, and they just kind of look at you and be like, oh my God, don't treat them bad. Just say, I understand. But they become the best messengers now for talking about what it means. That's important. Yeah. What's our time? I don't know. Are we good? We're good. 5 minutes. Any other questions? It's a pleasure to talk to you as my colleagues. I hope that I gave you some information that was helpful. Yes. Question.
Dealing with the invincible millennial or the invincible Gen Zer.
Yeah.
So you started to touch on this belief of like, but I'm not going to get it.
Yeah.
So
or that I'm gonna get over it.
Yeah. Right. And might have even seen that, right? They might have seen a friend get COVID and be fine and have kind of a flu for a couple of days and they're fine. Yeah. So how to approach the conversation with the invincible young person, because I'm going to be treating kids. And I want to be able to have that conversation with, my teenagers.
I would bring up that because some of them will bring up to you that the adolescent myocarditis after the vaccine, you've heard about that? And they're like, well, I don't want to get this vaccine because I've heard about this thing that happens with your heart and you get some infection and, that's bad. And what we found is that that's relatively transient and that, those patients recover pretty nicely and it's still extremely rare. So what do you tell somebody who believes that it's not that big a deal? Well, that the increase in the numbers of patients who we do see now in the ICU and those who are being hospitalized with severe symptoms are in that category. So no, they're not invincible. And yes, it is likely that because they are younger and their immune systems are stronger, that they are likely to recover. But let us be clear, scarring of the lungs, potential for significant long haul disease is not something that most young people want. And there was that special, I don't know if we can really quote it, but ESPN put some of these amazing athletes who had all had COVID, who were barely able to get back to the level at which they were because they just couldn't. Was COVID different last year than it is now? Probably worse in the sense of the numbers of variants, but that these were people in peak condition who had severe illness. I think that's important to tell people that no one is invincible and that anything that you can do to prevent and reduce the incidence of illness is a smarter decision than doing nothing. Once again, you ain't gonna touch everybody, but you can give them as much. I feel like that's very anecdotal, but it's information that they can look up because believe me, they'll look that up long before they look up the spike protein and the information with regard to messenger RNA. ESPN is way more interested than that. So you listen and you accept and understand and you say, this is it. And answers, you ask me a question about, what's the long haul with regard to the children? Just say, I don't know. That's it. And then next sentence, but what I do know is this. And they'll go, okay, well, I'll think about it. I'm like, okay. I think there are lines too when people's families, when you say, well, I'm not going to allow you to see my new baby because you're not vaccinated. That gets a lot of people's attention in people's families. New baby. They're like, it ain't happening. I'm not bringing you over here. That's important. July 4th coming up, the barbecue, everybody like, no, you ain't coming over. You ain't vaccinated. I mean, there are things you can do that people know you're not getting on a flight because you're not vaccinated and you go into a country where it is likely that you'll be highly exposed. I mean, there are things that the government seems like they're thinking about doing, but these are things that we can do. And I think if you draw that line, it's interesting how if they like you, they might go get a vaccination because they want to go to your house for July 4th. Especially since all y'all well-paid physicians on the line, y'all usually the houses people want to go to. Just being mean. All right.
Yeah, well, I restricted travel to some people because of that.
There you go. They're like, oh man, I love me some Denise. I can't, she won't let me come over her house. Forget her. And then they go, I guess maybe I need to get the vaccine. Sometimes it's that little, you know what I mean? What you say, little by little, it adds up, especially for the vaccine hesitant. Because we've gotten all the people that were interested. That's clear. We're done with that. We're now working on that very resistant, but not recalcitrant. Okay, the ones that ain't do it, please don't waste your time. You know who they are. Don't do it. Because they got about a list of things for everything you say. Stop wasting your time. And just say, thank you for this opportunity. I wish you the best. Move on. Can you help everybody?
Yep, I agree with you on that.
There you go. Well, it's been a pleasure talking to you guys. Y'all got my number. You can give me a call. If we want to talk about the latest JAMA article or the latest, Society of, Maternal Fetal Medicine, we could talk about it, I'm
not
more than
me.
happy. Okay. Since I got all my OBs on the call. And of course, internal medicine and family practice have great information that I've learned from them about some of the ways that we are treating. I even talk about, I didn't bring this up, that treatment has gotten a lot better too, right? So what we've learned, unfortunately, with so many ill people is how effective our treatment protocols have gotten. Hey, Cosette. And Cosette's at a place where, with underserved people that, we got so many folks out there that are sick, we didn't figure out how much remdesivir to get, whether or not we need to add the monoclonal antibodies at what's in such, what time, when do we admit appropriately, and whether we prone them at this point or not. So we've gotten good, unfortunately, at Black folks getting sick and dying. It just is what it is. So now we know who and when and what to do. Why you need to be that person? Can't we just get the vaccine and not have to go through that? But yes, we are good on that end as well, a lot better than we used to be. And many people on this call could talk about that way better than I could. But I ain't trying to be over there. I like talking to y'all, alive and well.
Amen. Amen. And so
hey,
I've been
Lorna,
listening and trying to work at the same time. And
we all do.
I did not hear, no, babies, I did not hear the word miracle. Now, am I right or wrong?
About?
I did not hear the word miracle this whole discussion. So that's the thing I say to my people. I say, look, you got to know when you see a miracle. This is a miracle. God works through the scientists. Who you think gave him the idea? Come on now, baby.
That's right.
So that's my word. And I tell him, when I sat down, I said to the man, put the miracle right here.
Amen. There you go.
But wait a minute.
Put the miracle.
Come on now.
Last thing. Listen.
Yes.
I was sitting there and I said, God, if you're going to take me out of here behind a vaccine reaction, I'm ready to go. And I meant it, because look, do the math. Are you going to be part of the 0.0005 or part of the 50,000 million? So that's it.
Go on with it. I love it. I love it. I love it. Any way we can reach them. You know what I'm saying? I love it. I love it. Go on, God, put that miracle right here. Thank you very much. Amen. Drop the mic. There you go. I love you some Lauren. I love Lauren. I love her. Okay, I'm done, because this is just like talking to family, y'all. I mean, we all see each other all the time, but I hope that it was helpful. It's still, clearly it's my perspective, but it is a combination of what I believe to be excellent evidence-based information from This Is Our Shot, which I've been involved with at least for the past few months, as well as the information that we all have from the CDC and the FDA. And of course, I'm Kaiser dipped and true, Kaiser Permanente, and all of the Kaiser Family Foundation information that they give us every day on how to manage our patients here in Southern California. So I feel like I may not be the best messenger from an evidence-based infectious disease specialty standpoint. I'm just a lowly OBGYN, but I do know, at least I wake up every day, why I became a physician, why I'm an OBGYN, and the importance of who we take care of every day. And everybody on this call is clear about that. And so educating ourselves as best that we can in a way that can be conveyed effectively is what we're all trying to do. So I thank you for listening. And, I can take off these lashes after all these presentations.
Love you, LaTanya.
All right. Okay, I'm done.
Okay, bye.
Bye, guys. Tina, not Tina, but Kim, are there any other questions that you have for me or something else we need to do?
Nope, I feel like we covered it all. Thank you so much, everybody.
Yay. All right, my dear.
Wonderful. Thank you.
Thank you. Talk to you guys later. Okay, bye-bye.